And then, of course, Ms. Bulach would moderate the meeting, if you don't mind. No, we don't mind. Not at all. It's a pleasure to see you, Maxim. Yeah, of course, we are sitting in the neighboring offices, actually, but we are connected online. Hello. Hello, ladies and gentlemen. We are starting this event in the following way. First of all, I would like to welcome everybody and say that on behalf of the Ukrainian Parliamentary Committee on Nations Health, Healthcare and Medical Insurance, we start this event dedicated to the 15 years anniversary of FTCT. And I will say a few words and then I would give the floor to Dr. Nino Bertzuli. And next we'll have Dr. Aru Banerjee, if you don't mind. So, on behalf of the committee, ladies and gentlemen, I would like to welcome you all. 15 years ago, in 2006, Ukraine has ratified the Framework Convention of the WHO on tobacco control. It has been the first step, the first international treaty of this kind, and of course, its value is immense, both globally and for Ukraine in particular. The Framework Convention has been created under the aegis of the WHO, and it has brought in over 180 countries uh, uh, in tobacco control efforts. Ukraine has shown significant progress in the latest years, and it has enabled us to reduce the tobacco epidemics in Ukraine. In this period, we have adopted the law on tobacco control, and this law has outlined the main principles for the policies in this sphere. Also, the regulations have been updated and the population is protected because the advertising and sponsorship is limited. Also, there's ban on smoking in public places and display ban. Another important impact in combating the tobacco epidemics is the increase in excise tax for tobacco products, according to the to the FTCT. So lately, there has been over threefold increase in the revenues from the excise. And the combination um, of the taxes and non-tax measures has led to the decrease in smoking prevalence. So we can say that these measures have led to the reduction in asthma, ischemic heart disease, and other um, disease incidents. Still, however, the threat is there, and the positive trend in the reduction of smoking prevalence has stalled in 2017, and in the latest 2 years we see a negative trend. We see the possible increase in tobacco consumption because younger people are engaged in the use of novelty tobacco products, and the so-called HTPs, heated tobacco products, electronic cigarettes, aromatic tobacco products, they require further regulation. And that is why we do not stop. Uh, and the countries which have ratified the FTCT should increase the regulation, and the there's also the European Directive 2014-40, which also sets out regulation on the tobacco on the tobacco control and regulation, and it has to be incorporated in the Ukrainian legislation. The association agreement between the Ukraine and the EU sets the obligation onto Ukraine to integrate the directive uh, And it is Article 9 of the Framework Convention that also reinforces that. We need to put bigger health warnings. We need to ban all forms of advertising. Um, this is relevant to Article 13. And unfortunately, we still see advertising in places, in points of sale of tobacco products. So now a draft law has been heard by the parliamentary committee, the draft law 4358, which is aimed to implement these clauses. I hope that this draft law in the nearest future would be heard and supported by the parliament. I would like to say thanks to all the partners, all the international organizations, NGOs, in particular the WHO and the head of the country office, Mr. Jarno Habit, the representatives of the World Bank and the EU the delegation to Ukraine, and our colleagues from the parliaments of Georgia and Ukraine for strengthening the tobacco control measures. We are convenient that the further success in the Fctc implementation is possible only if we are really dedicated to the values of public health, and we make sure all the guidelines and principles are implemented. By joining the efforts, we can make sure that the world is free from tobacco in the 21st century. Thank you for your attention. And now I'm happy to give the floor to Dr. Nino Berzulli.
Thank you so much. And yeah, good afternoon. Your Excellencies, distinguished partners, esteemed guests, dear friends and colleagues. It is my great honor to speak to you today on this very memorable occasion. 15 years ago, Ukraine took an important step to make healthier its population. Ratifying the WHO Framework Convention on Tobacco Control was the start of this commitment to implement the policies that were not always popular, but known to make a difference. And due to this commitment today, as it's already been pointed out, we are celebrating the successes achieved over these years. But we can also discuss the challenges that we are facing today and the ways to address those challenges, to define the next steps that are needed to implement the robust tobacco control policies that are outlined in the WHO Framework Convention on Tobacco Control. In doing so, we know that we can and will save the lives and will protect and safeguard the health and the well-being of generations to come from the scourge of tobacco. Ukraine can be proud of the results of the tobacco taxation policies, and that they are implemented, but these are also now recognized internationally as one of the best practices in relation to taxation to cigarettes. Increasing the average excise taxes on cigarettes per pack in the period of 2008-2018 resulted in a 12-fold increase in tobacco excise revenues and a 40% reduction in the number of daily smokers. This is really great achievement, and big congratulations on this really big achievement. Ukraine can be also proud of the protecting people from the exposure of tobacco smoke in enclosed public spaces, workplaces, and the public transport. But of course, as we've heard, more can be done and needs to be done. If we look at the European region overall, Europe still has the highest prevalence of tobacco use in the world, with the consequent high level of harm to the economy and health. But it is also a leader in the implementing of the WHO Fctc. This puts the region in a unique position to be the exemplar in a global tobacco control, but also take its responsibility to do more and to do sooner. Looking at the future and moving towards 2030 and the Sustainable Development Goals, we have a window of opportunity in the coming 9 years, and we all need to make use of it fully. That novel tobacco products in this regards are a major challenge in the region, including in Ukraine, as it has been already outlined, and with limited objective information available on those products and how the countries may want to consider to regulate them. This is something that we really need to work together. These products are promoted by the tobacco industry as so-called the reduced risk products, a narrative that the industry is using to seek more favorable regulatory treatments for them. And it is particular public health concern especially for children and adolescents that they are taking up the use of these products. Exposing children and adolescents to nicotine can have long-lasting damaging effects on brain development and lead to nicotine addiction. Adoption and implementation of the robust tobacco control policies as outlined is in the WHO Framework Convention on Tobacco Control, and broadening the scope to include the novel products, emerging nicotine and the tobacco containing products is needed to combat and to address the tobacco epidemic. Of course, these measures require dedication, requires the support, the coordination, and the stamina. But payoff of these actions is improved health and the well-being of citizens of for generations to come. And this can be done only in unified way, united together. Politicians, the public sector, the civil society, development partners, and the UN organizations coming together, as we see today, through learning and the sharing between the countries. This is the only way how we can tackle and combat tobacco epidemic in the European region and Ukraine. Thank you so much for this opportunity to speak, and I wish all of us the successful meeting. Дякую.
Дуже дякую, пані Памо. Хочу до вітального слова
запрошую. Thank you so much. Now I would like to give the floor to Dr. Arup Banerjee. The floor is yours.
Thank you very much, distinguished colleagues, ladies and gentlemen. Thank you so much for inviting me to this very important event. I want to start today by recognizing that today Ukraine is reeling under the terrible impact of COVID-19. Tragically, over 30,000 Ukrainians have lost their lives to the epidemic. But it is also important to recognize that tobacco smoking by itself kills between 84,000 and 115,000 Ukrainians every year. So that's 3 times the number of people tragically lost to COVID-19. So why this alarming level of fatality? You'll hear a lot over the course of the next couple of hours, but essentially, of course, it's because today every second man and every 6th woman in Ukraine is a smoker. Smoking rates among Ukrainian men are 2.5 times the level in the US or UK, and even 1.5 times that in neighboring Poland. But as we will also hear, and we have heard today, this is a very important anniversary because it's important to note that Ukraine has made very good progress in the 15 years since ratifying the Fctc. Just in the 8 years since 2013, the number of daily smokers in Ukraine has fallen by about 40%. And this is indeed because Ukraine has been adhering to the Fctc's commitments, including the systematic increase in tobacco taxation, the banning of smoking in restaurants, workplaces, other public locations, and of course, curbing of cigarette advertising. Now, one of the major achievements during this period is, of course, the progress on Fctc Article 6. This is the price and tax measures to curb tobacco consumption. Ukraine has increased the ad valorem component of tobacco tax several times between 2008 and 2012, and 2008 introduced the specific minimum excise tax, which has also increased over the years. A key moment for us was the 2017 decision to adopt the 7-year plan for harmonization of tobacco taxation rates with those of the EU, for which we, the World Bank, were proud to provide technical advice. And I think a very important benchmark in this plan was the event in January 2021, when the increase of the excise tax on heated tobacco products was increased to equal the minimum excise tax on cigarettes. This, we believe, is an extremely important measure and one that we strongly believe should be maintained. So why do I say this? Or why the emphasis on this? Because tobacco taxation, as you've heard, including the taxation of heated tobacco products, we believe is both good science and good economics. We'll hear a lot about the science. There is extensive scientific literature to show that tobacco taxation, which reduces tobacco use, reduces both illness and reduces death. And of course, this is not just for cigarettes. The US CDC says that heated tobacco products have not been shown to be any less harmful than conventional tobacco products. And according to the WHO, they contain a greater number of harmful and potentially harmful chemicals than a regular cigarette. And let's not forget that it's also good economics. Tobacco taxation, of course, raises the stream of resources, and these resources are important for the economy to finance important public benefits. In 2020, as many of you know, the government collected about 54.7 billion hryvnias from tobacco excise taxes. This is almost half the financing of the program of medical guarantees. More importantly, though, than these immediate resources, Ukraine saves future health-related expenses, and most importantly, saves lives through this taxation. So tobacco taxation is very important to preserve Ukraine's future. Like Dr. Perevinis and Dr. Bedzulin, I must confess I'm particularly concerned about younger smokers in Ukraine. The statistics show that every fifth child in the 13 to 15-year age group smokes cigarettes or heated tobacco products. And that number, as we've heard, has been increasing. So an effective tobacco control program needs to focus on curbing consumption among the youth, including making heated tobacco products that are very popular among teenagers expensive enough so that children do not take up the habit of smoking. Ladies and gentlemen, I really do want to celebrate today Ukraine's progress since ratifying the Fctc. But of course, part of the discussion today is that there is still quite a way to go. I would like to underscore in conclusion, therefore, the importance of continuing to implement the tobacco tax plan. Ladies and gentlemen, distinguished colleagues, as Ukraine works towards a healthy and prosperous future, the World Bank looks forward to supporting you, including in these efforts. Thank you very much.
Дуже дякую пану Банерджі за цю гарячу промову.
Thank you so much, Mr. Banerjee, for your passionate speech. Thank you so much again. So I hand it over to the moderator, my colleague, Member of Parliament of Ukraine, head of the subcommittee on ensuring epidemic safety, combating HIV, AIDS, and socially dangerous disease, Ms. Lada Bulach. Lada. Once again, warm welcome to the audience. Thank you for a very lofty level of holding this virtual meeting. We thank our partners, the Life NGO, for organizing the live streaming so that every Ukrainian citizen can watch it and find out things and later participate in anti-tobacco efforts in Ukraine. So let's continue with the review on the status of the Fctc implementation. It's been 15 years since Ukraine is trying to maximize the implementation of WHO Fctc in various forms, in various pieces of legislation, in order to reduce the numbers of new smokers, Unfortunately, as we heard recently, there's an increase in the number of those, and also to curb harm caused by the disease associated with active tobacco use. Therefore, personally, in my committee, volunteered to look into this issue as part of our parliamentary committee on the Committee on the Nation Health. And for 2 years, I was looking at the legislative initiatives in this field. As a reminder, every year, this country loses 85,000 people to disease associated with tobacco use and also with exposure to tobacco tobacco smoke. And this is one of the major factors for NCDs. And it is a major percentage, 25 of cancers, 17% of cardiovascular, and the greatest share, 50% of respiratory disease. And these diseases were specifically associated with smoking. Therefore, guiding principles of the Convention and WHO and the decisions of the Conference of Parties provide a very clear and straightforward list of measures to protect the citizens from advertising, from progressive and aggressive marketing of the tobacco industry, who is actively, unfortunately, promoting smoking among the citizens of this country. We need to defend the right of Ukrainians to live a life free of tobacco. Our priority is protecting children, of course. Looking at the figures, we see that it is the young Ukrainians who are under 30 years of age join the ranks of tobacco product users of all kinds. Therefore, implementing Fctc in Ukraine has already reduced prevalence in smoking. Yet, unfortunately, I have to admit it that every fifth child aged 13 to 15 years old in Ukraine continues to smoke and to use tobacco products, be it e-cigarettes or other electronic devices for smoking. As we all know, based on the WHO analysis and recommendation, there are no more or less harmful tobacco products. All of them are equally harmful. Therefore, we need to be equally determined and be equally robust in limiting access to any forms of smoking, especially in children and minors. We are aware of the challenges in hand, and Parliament of the 9th convocation that was working for 1.5 years, and we initiated additional measures to protect children from smoking. For over a year, our committee, the Health of the Nation Committee, is trying to initiate a new draft law to enhance and ensure better implementation of Fctc into Ukrainian legislation. Last year, a law on 1019 was adopted. Therefore, there is a ban in plan on selling e-cigarettes to persons under 18. Therefore, minors cannot purchase e-cigarettes legally in Ukraine. And this holds for heated tobacco products as well and e-smoking devices. There is a ban in Ukraine on selling e-cigarettes to minors. It's fully implemented. If these provisions of law are violated, then there is a fine for the seller. We aim to protect minors, first and foremost, to make sure they have no opportunity whatsoever to start smoking. Another major breakthrough last year was the efforts by the Parliament to introduce an excise tax on e-cigarettes, both with nicotine and without. There was also a decision on harmonization access on cigarettes. Therefore, the excise tax for e-cigarettes equals to the regular cigarettes excise. Therefore, no exemptions. Nothing is exempt. All types of cigarettes have exactly the same excise tax. And this limits price access to cigarettes. Thanks to these developments, the price acceptability and access to cigarettes will be reduced, primarily in children. This paves the way also for additional revenues to the budget. A new challenge is the marketing of heated tobacco products. Unfortunately, they're not covered by valid legal framework. It's still legal in Ukraine, and therefore those legal loopholes are used. Therefore, it's advertised, especially targeting children, especially the heated tobacco products or the HTPs. And it's common in many countries of the world. Ukraine is not exception. And this year, we're trying to address this challenge. There are negative impacts. Just to give you the figures, I'll compare figures for 2019 and 2020. Smoking in HTPs in young population, under 30s, and there is an increase in male population threefold, and among female population a fourfold increase. First, since a few years, we see an increase in smoking prevalence in young men and women under 30. And this is the data of a Kyiv Sociology Institute research. And this piece of research demonstrates that there is a significant threat. There is an increase in the number of young tobacco users. And this is a devastating problem. So it's not only about increasing excise taxes or banning selling cigarettes to minors. I'm talking about the problem of behavior, the problem of choice. This is what we're up against in Ukraine, and we admit it. Young people in Ukraine are willing to start smoking. And research findings are the example of that. So we see a threefold increase in female young smokers and fourfold increase in male young smokers. Therefore, the committee keeps working to protect the citizens, the Committee on Nation Health, Medical Care and Health Insurance. And I'm proud to say that this Monday, yes, this Monday, unanimously approved the draft law of 4358 that we elaborated on for longer than 12 months. So it was approved, and this committee, the committee recommended the parliament to look at this draft law in the first reading. Now, I'll elaborate on this draft law a little bit more. What are the provisions? It's about banning the display in points of sale. It's about the heated tobacco products. It bans advertising, any sort of advertising of HTPs, e-cigarettes, and even devices for using the tobacco orally, so without heating it up. So this is all in line with the directive. For example, introducing the graphic warnings with a specific area covering 65%. And this norm has been integrated by many countries of the EU, and we see the positive impacts of this ban, and we're trying to implement the same policy in Ukrainian legal framework as well. And also banning e-cigarettes and refillers advertising, and also introducing rigorous technical requirements. Therefore, we create an obligation for all manufacturers to timely and validly inform about the composition of their products. And they must report to the Ministry of Health and to inform them. We believe that the Ministry of Health needs to have the latest information about all substances that are part of those products in order to effectively regulate access to tobacco products and limit it, obviously. And also, truth needs to be told about the actual composition. As a reminder, our parliamentary committee is in the process of making of the public health system. A law was approved on the system for public health. In the first reading, it was approved. And I believe that the priorities of creating a public health system will also have a positive impact on regulating access to smoking in Ukraine. The system for public health specifically is at the best position to look into prevention, into primary and secondary prevention among the population nationwide, to ensure that every Ukrainian citizen have the valid information about the harmful impacts of smoking. In conclusion, I'd like to emphasize the findings on the Global Tobacco Survey that was held this year. And the findings show that 6 out of 10 children who are currently smoking now are trying to quit smoking, and therefore Ukraine needs to provide the relevant health care to smokers who are already unfortunately addicted. This holds true for both mental health support and medical support for those who want to quit smoking today, especially children. These children are trying to quit now. Therefore, I am adamant that my colleagues and me are willing to adopt the necessary policies to make sure that Ukrainians can quit, to ensure that the generations to come in Ukraine grow up in a totally new field of motivation so that they can make informed choices and they know how harmful that is. Moreover, our parliament will pass all the necessary pieces of legislation to make sure that there is a total ban on advertising on tobacco products, both on the internet and offline. Thank you for listening. Thank you for joining us today. Thank you for agreeing to come to this meeting initiated by our committee. And a special thanks to the representatives of the World Bank and representatives of various programs of European WHO office. Thank you for taking an interest in the situation in Ukraine. And I just want to celebrate your prominent role in the addressing of this challenge, because you are an incentive to us. You are proactive participants of this process, and you help us ramp up our efforts, me, my colleagues, and the civil society. Thank you all for making sure we don't tolerate that. Because for the last 5 years, you see an increase in the tolerance for smoking. With that, I suggest that we change gears and we see a small video instead of listening to speeches delivered. We thank WHO office in Ukraine who created this video, but it's a very prominent examples because it walks us through all the most pertinent
15 березня 2006 року Верховна Рада України ратифікувала рамкову конвенцію з боротьби проти тютюну Всесвітньої організації охорони здоров'я. На сьогодні сторонами конвенції є 182 країни, у яких проживає понад 90% всього населення планети. За 15 років Україна подолала непростий шлях у боротьбі з тютюновою епідемією.
Мене звати Олесь, і в цьому березні мені виповнюється 15 років. У 2006 році, коли я народився, життя було зовсім іншим. І мені навіть важко уявити такий світ. В ресторанах і взагалі у всіх громадських місцях було дозволено курити. І реклама тютюнових виробів була повсюди. Пачка сигарет коштувала приблизно 2 гривні, тобто менше, ніж $1,50.
Згідно досліджень, у 2006 році курили 31% українців старше 18 років. У 2007 році у старших класах курили 34% хлопців і 20% дівчат. Україна входила у першу п'ятірку країн за поширеністю куріння.
У 2005 році був прийнятий закон про обмеження тютюнокуріння в громадських місцях, і він мав вступити в дію з липня 2006 року. Далі в 2006 році була ратифікована рамкова конвенція Всесвітньої організації охорони здоров'я по тютюнокурінню. Таким чином, 2006 рік – це рік радикальних або кардинальних змін відношення громадськості до тютюнокуріння в Україні.
Рамкова конвенція ВООЗ з боротьби проти тютюну – це міжнародний договір, що спрямований на боротьбу з тютюнокурінням. Він включає заходи, розроблені на основі фактичних даних, які можуть покращити стан здоров'я всього населення. За останні 15 років Україна прийняла та впровадила ряд таких заходів. Заходи РКБТ стосуються зростання цін та податків, оманливого маркування, допомоги людям кинути курити, захисту людей від диму та тютюну в громадських місцях та ліквідації незаконної торгівлі. Суттєвими кроками до зменшення поширеності куріння у рамках реалізації конвенції стали заборона реклами тютюну на зовнішніх носіях та у друкованих ЗМІ, а також серія підвищень акцизу на тютюнові вироби у 2008-2010 роках.
У 2006 році за кишенькові гроші підліток міг купити у 4 рази більше сигарет, ніж зараз.
Україна була визначена пріоритетною країною глобальної ініціативи Блумберга зі скорочення вживання тютюну. Тоді ж розпочався масштабний рух громадських активістів, і боротьба з тютюновою епідемією вийшла у публічну площину. Проведення акцій із залученням медіа дозволило артикулювати прагнення суспільства боротись проти тютюну та впливати на політичні рішення.
Суспільний резонанс став підґрунтям для посилення антитютюнового законодавства, в першу чергу з метою збереження здоров'я дітей та молоді.
З 2005 по 2011 рік, завдяки заходам, імплементованим в рамках конвенції, поширеність підліткового куріння в Україні зменшилась на чверть.
2012 рік явився знаковим, було прийнято декілька важливих, надзвичайно важливих законів. Це в тому числі і закони про заборону тютюнокуріння в барах, в ресторанах.
На той час 84% громадян підтримали ідею закону, який забороняє курити у громадських приміщеннях, включно з барами та ресторанами. Черговим кроком у боротьбі з курінням стало розміщення на пачках сигарет кольорових медичних попереджень, малюнків із зображенням хвороб, викликаних курінням.
Пачки тепер показують правду. Картинки мають більший вплив, бо, якщо чесно, хто читав ці написи?
І нарешті, у 2012 році був ухвалений важливий закон про заборону реклами, спонсорства та стимулювання продажу тютюнових виробів. Відтоді тютюновим компаніям перекрили можливість просування своїх брендів, у тому числі і через проведення концертів чи фестивалів.
Щодо ефективності заходів контролю над тютюном, міжнародні експерти пропонують так званий скрім-тест. Це чи буде тютюнова індустрія волати про те, що цей захід неефективний. Чим гучніше вона волає, тим ефективніший цей захід.
У 2014 році Україна підписала угоду про асоціацію з Європейським Союзом, в рамках якої зобов'язалася до 2025 року підвищити акциз на сигарети до європейського рівня, а також запровадити ряд ефективних заходів з контролю над тютюном. З 2007 по 2020 рік надходження у бюджет від акцизів на тютюнові вироби зросли з 2,5 мільярдів до 55 мільярдів гривень. Водночас, завдяки антитютюновим законам, які були ухвалені в рамках РКБТ, за останні 10 років кількість курців знизилась вдвічі. Українці, захищені від згубного впливу тютюнового диму, наочно бачать смертельну шкоду від куріння на пачках сигарет, а підліткам не нав'язується крутість тютюнових брендів через концерти чи фестивалі. Сьогодні Україна стикається з новими викликами. Новітні нікотинові та тютюнові вироби стають особливо привабливими для молоді. Через це нам потрібно впровадити відповідне та жорстке регулювання. Тільки маючи комплексний пакет заходів РКБТ разом з новими правилами, ми можемо покращити контроль над тютюнокурінням в Україні та у найближчі роки мати більш здорову Україну.
В розвинених європейських країнах затверджено стандартизовані пачки сигарет з великими відразовими малюнками і без логотипів. В Україні поки що таких немає. І я добре знаю бренди сигарет, бо кожен день бачу викладки в кіосках на вулицях.
63% дітей постійно бачать викладку, рекламу сигарет і електронних пристроїв для куріння в місцях продажу. Для тютюнових корпорацій викладка і реклама є дієвим інструментом у залученні молоді до куріння. І тому наша мета – прийняти законопроект, який, серед іншого, заборонить викладку тютюнових виробів. А це прихована реклама.
Діти, які бачать вітрини з пачками сигарет та яскравою рекламою тютюнових брендів, на 64% більш схильні почати курити.
Електронні пристрої для куріння є новим викликом. Адже тютюнові корпорації, користуючись відсутністю законодавчого регулювання, агресивно рекламують їх дітям в соцмережах, використовуючи лідерів думок та зірок. Натомість українці підтримують прийняття комплексного законопроекту із боротьби проти тютюну та електронних пристроїв для куріння. Такий законопроект уже зареєстрований в парламенті, але тютюнова індустрія чинить колосальний спротив його прийняттю.
Серед підлітків 50% мають досвід куріння електронних сигарет, а 7,4% – тютюнових виробів для нагрівання.
Я знаю, що я є мішенню для тютюнових корпорацій. Чим раніше я почну курити, тим більше від мене буде грошей компанії. Але я добре усвідомлюю шкоду тютюну для здоров'я. І я хотів би жити в Україні без тютюну.
Ось такий.
So, this was our useful and interesting video to celebrate the 15th anniversary of FTCT, WHO FTCT. Thank you, Jarno. This is a fantastic media product. We've watched the longer version. There's also a shorter version. And I hope that all the members of parliament, representatives of the MOH, would use this video to promote tobacco cessation and to really increase the awareness of the issue in Ukraine. I would like to say thanks to my colleague, Mr. Perabinis, who was moderating the previous part, and now the next session would be moderated by me, and I would like to invite three presenters. Mr. Igor Ivashenko, Deputy Minister of Health of Ukraine on European integration. He will present on the increased pace in the implementation of the FTCT. And Dr. Adriana Blanco Marquiza, the head of the Convention Secretariat of the FCTC, and Mr. Remy Duflo, Deputy Head of EU Delegation to Ukraine. He will present on EU's perspective on Ukraine's effort to tackling smoking. And now, Igor Ivashenko, are you online? Please, the floor is yours. And once again, I would like to reiterate to all the participants to follow the time limitations. We don't want to interrupt you. Thank you, dear participants. It is a real pleasure to take part in this roundtable on FCTC implementation. And indeed, Ukraine has achieved significant progress in this process. And that includes the regulations to limit smoking in public places, in restaurants. We have amended the regulations on health warnings. It's now over 50%. And the display ban, which was introduced, also is important. But today, I would like to look at the current challenges which the MOH and the parliamentary committee is facing. We've heard lots of figures today. And in general, in order to keep the downward trend in tobacco use in Ukraine, one of the main tasks is the implementation of 2440 European Directive. As Deputy Minister on European Integration, I would like to say that tobacco control is one of the 4 requirements of Chapter 22 of the Association Agreement. And I really hope that this year the Ministry of Health of Ukraine would be able to report on the implementation of that chapter in full, because all the previous laws have already introduced some of the requirements and some are still outstanding. And this is about the requirements in the increase of the health warnings to 65%, as was mentioned already. Also, there should be health warning on e-cigarettes, and they should be limited sale, and also aromatic cigarettes should be banned. And well, we are trying to move ahead, but the tobacco industry is also moving ahead, and they introduce new marketing technologies to develop the idea of tobacco smoking, to make it attractive among the population. And today we often hear slogans of smoking harm reduction and reduced risk of HTPs. I would like to note that tobacco industry has tried several times to promote their interests using reduced risk idea. Many countries have seen this idea back in the times when filter cigarettes were introduced, when slim cigarettes were introduced, aromatic cigarettes. And the tobacco industry keeps trying to find new loopholes and options to protect their interests, which actually contradict the interests of public health. So I would like to know that the Ministry of Health, and I know that the parliamentary committee, are also supporting the approach which is fully in line with the FTCT, the 8th conference on FTCT, saying that heated tobacco products should be regulated just as regular cigarettes. So even despite last year, the Parliament of Ukraine in the Committee on European Integration had many discussions on different means to implement the requirements. We thought of draft laws to of different laws to control tobacco, but we fully support draft law 4358 because it helps implementing FTCT with a comprehensive law, and we would not really disperse the norms and regulations in a series of different laws. That would be a more difficult approach. The parliamentary committee on European integration had a very lively discussion on the implementation of the rules of the European directive, and we kept standing with the idea that the MOH is fully the proponent of the implementation of the essence, not just the letter of the directives. And one of the advantages of the draft law 4358 is the display ban, and of course it's the full-scale regulation of HTPs and e-cigarettes in line with regular cigarettes. I hope that this year the Parliament would vote for these laws finally, and we will reinforce the trend, we will reinforce tobacco control in Ukraine, because there's no safe smoking. Thank you. Apologies. Was it only on my side? I had some connection issues. Igor, have you completed? Yes? Yes, yes. Yeah, I'm done. Oh, thank you. I hope all the rest have heard your presentation. Unfortunately, I had some connection issues. So, just briefly, we fully concur, we support the draft law. Of course, we know the MOH supports this law. Thank you so much. Now, I would like to give the floor to the next speaker, Dr. Adriana Blanco Marquizo, head of Secretariat of the WHO Fctc. The floor is yours.
Thank you very much, Mrs. Bulak. Your Excellencies, distinguished partners, esteemed guests, ladies and gentlemen, I thank you for the invitation. It's really a pleasure to be in a site with parliamentaries that are so interested and so knowledgeable about tobacco control, as Mrs. Bulak has shown us. So really it's a pleasure for me to participate here. In 2003, the member states of the World Health Organization made history when they adopted the WHO Framework Convention on Tobacco Control. The treaty, which entered into force 16 years ago, marked an important milestone in global public health and represented a major victory for better health and tobacco control. Tobacco is one of the world's most serious health challenges. And saying so in this moment, when we are still in the midst of the COVID-19 pandemic, may sound strange, but it's true. And that is because tobacco kills 8 million people globally every year. And around 1 million of those deaths occurs in people simply exposed to secondhand tobacco smoke. Even though tobacco does not have a biological vector, such as infected mosquitoes that spread malaria, it does have a non-biological one, the tobacco industry and its relentless marketing strategies. In fact, tobacco-related diseases are considered a pandemic, a slow, lethal, and prolonged pandemic that has killed 1 billion people over the last century. But tobacco is not only a health problem, and we have heard my colleague from the World Bank. Tobacco also has economic repercussions, and it impoverishes families and communities, impedes national economic progress, and burdens health systems. In addition, tobacco, throughout its life cycle, from farming and manufacturing to disposal, does irreparable harm to the environment. The case is clear. Implementing the WHO Fctc is a powerful means for parties to improve the lives of their citizens and ensure a better future of their countries. And it's for that reason that the convention has been included in the 2030 Agenda for Sustainable Development as a means of implementing SDG 3, which calls for good health and well-being. At the 8th session of the Conference of the Parties to the WHO Fctc in October 2018, parties endorsed the global strategy to accelerate tobacco control 2019-2025 in order to advance sustainable development through the implementation of the convention. The global strategy has been developed by and for parties and set out priority over the next 5 years. It also serves as a useful tool for the development of national action plans. We have a common enemy that invests tremendous effort and unlimited resources to undermine our work. The tobacco industry earns vast profits by addicting its customers to nicotine, which it sells in different forms, and this industry does not want anything to change. Countries with transitional economies including Ukraine, are seen by the tobacco industry as opportunities to expand their markets. Ukraine became party to the WHO Fctc in 2006, and I would like to congratulate the countries on progress on implementing measures such as the promotion of smoke-free environments, the introduction of pictorial health warnings on tobacco products, and bans on tobacco advertising and higher tobacco taxes, as has been already underlined. This important action decreased the prevalence of tobacco use in Ukraine among adults and even more markedly among youth over the last decade. However, further progress in saving lives requires a set of action and political commitment, like we have heard already that is in process with this new bill that is going to be considered soon in the parliament that also follows the UE directive on tobacco control. We need to make more products because the tobacco industry continuously creates new challenges. For example, today in many countries, and I see in Ukraine is exactly the same problem, they face the aggressive marketing of new tobacco products and electronic cigarettes to youth, and this needs to stop. Regarding heated tobacco products, it's important to note that the 8th session of the Conference of the Parties adopted a decision on novel and emerging tobacco products in which parties recognized that heated tobacco products are, in fact, tobacco products, and therefore they are subject to the provision of the WHO Fctc. In plain language, that means that heated tobacco products should not be used in a smoke-free environment, should be included in bans on tobacco advertising, promotion, and sponsorship, should carry health warnings, and should be taxed, among other actions. Ukraine, fortunately, has begun to act on this problem by raising taxes and to harmonize the taxes for this product, for the heated tobacco product, with the rest of the tobacco products. Before concluding, I also want to highlight the protocol to eliminate illicit trade in tobacco products, a complementary treaty that builds upon Article 15 of the WHO Fctc, which targets illicit trade in tobacco products. The protocol will help protect the gains made under the WHO Fctc by keeping illicit and usually cheap and easily available tobacco products out of the market. Currently, the protocol has 62 parties, and more parties are needed in order to make it as strong as the WHO Fctc itself. I sincerely hope that Ukraine will consider becoming a party to the protocol soon and take advantage of the new opportunities for international cooperation that the protocol provides. Thank you very much, and I wish you good luck with the new bill that you have in consideration. Thank you.
Дякую, Adriana. Thank you, Adriana. We will not stop there, for sure. Remy Defleur, the floor is yours, Deputy Head of EU Delegation to Ukraine. Please welcome. Thank you, Lado.
What should I say, since I see the parliamentarian from Georgia here? Distinguished colleagues, ladies and gentlemen, thank you very much for this opportunity to add a few words to the previous considerations. To the risk of repeating what the previous speakers have said, let me hammer a basic message, which is that tobacco use in Ukraine imposes a substantial health and economic burden on the whole population. Mrs. Bulak, you named it, 85,000 deaths every year, productivity losses to the tune of 4% of gross domestic product in 2017. Besides the avoidable individual tragedies, it is all the national community that ends up paying the bill. It is perhaps no coincidence if one of the key steps to address this epidemic, this other epidemic, should I say, was decided in the wake of the EU-Ukraine Association Agreement. I mean the 7-year plan of 15th of December 2017, which introduced multi-year consistency and predictability in the tax policy for manufactured tobacco. It was a strategic step because consistency and predictability are the keys to influencing social behavior. Strategic also because the evidence proves that higher tobacco taxes are good for public health and increase life expectancy, a key development indicator. Raising taxes by just 10% can reduce cigarette consumption by 4%, and decreased smoking reduces the burden of non-communicable diseases, premature mortality, and disability associated with smoking. But to the point of today's celebration, Let me stress that the WHO Framework Convention on Tobacco Control is an important avenue to align Ukraine with the EU in the area of public health and tobacco control. And it is good to see that Ukraine has reached remarkable achievements here. For instance, a 20% decrease in the smoking population since 2010. At the same time, with 23% of adults, smoking adults, the level of tobacco use remains high. This raises questions about the current laws, their efficiency, their enforcement. I'm sure that these words sound very familiar to those who follow Ukraine's progress in other areas of reform. And indeed, there is no other way to move forward and achieve concrete benefits than better legislation and better enforcement. What does the association agreement say in this respect? In Article 352, Ukraine undertook to bring gradually its excise rates up to the EU levels, and it is the purpose of the 7-year plan up to 2025. Ukraine also committed to adopt other measures aimed at the prevention of tobacco use and at the implementation of a WHO Framework Convention, notably by introducing the taxation of tobacco products and heating systems in line with WHO recommendations. As you may know, the implementation of these commitments is monitored constantly through a continuous EU-Ukraine policy dialogue. As recently as January, this dialogue delivered important results regarding the taxation of tobacco products for heating purposes and cigarillos, as well as liquids used in electronic cigarettes. It is important, it is new, these are novel tobacco products. Many speakers have already underlined the importance of tackling this problem. Remarkably, Ukraine has also expressed its interest and commitment in our dialogue beyond the letter of the association agreement to approximate with EU tobacco legislation, Directive 2014/40. This implies to take a public health approach to legislation, including the novel tobacco products denounced by the previous speakers. I welcome the fact that draft law 4358 aims to meet Ukraine's commitment in this respect, and hope that, unlike in some past instances, there will be no pushback in Parliament against this effort to modernize the tobacco legislation. In the current public health crisis, it is more important than ever to be ambitious and vigorously push for having the right laws in place. In this spirit, let me go briefly through a few further policy steps that we recommend. First, the official monitoring of tobacco industry lobbying, reporting it at the national and international levels. Second, of course, more public information campaigns, although of course they require public funding. Third, to ratify the WHO Framework Convention's protocol on the elimination of illicit trade in tobacco products. Fourth, better control over the payment of fines for the sale of tobacco products to minors. Sixth, to strengthen tobacco control legislation by extending the requirements for smoke-free premises. And last but not least, and you mentioned it, Ms. Bulach, the removal of point-of-sale advertising. In conclusion, let me stress that the EU is firmly intent on continuing to support Ukraine in this important policy area, and we invite the government to make full use of the EU-funded technical assistance projects now in place. 2 projects support to the creation of a modern public health system and health system development in Ukraine. Both are designed to help Ukraine tackle non-communicable diseases as well as tobacco use. So thank you again for this invitation. The EU delegation would gladly take part also in the panel discussions that will follow. Thank you very much again.
Lada, you are muted.
Lado, sorry. Thank you, Remy. I'll just repeat what I said before. It's not only the discussion and there's interest to fighting tobacco, you also provide some funding for the projects that really help the civil society to remind the government that the issue is still there, it's not going anywhere, and the issue needs to be addressed. Thank you. So I wrap up this section and I give the floor over to Jarno. He will facilitate the next session.
Thank you, Lada. And we're changing the gears to keep everybody focused and the attention to us because I know that the long virtual meetings are sometimes difficult to follow. So we have 2 more sessions to go in next 55 minutes. And first, we would like to hear 2 presentations, and those are concentrating on implementing Framework Convention and to inspire a little bit the panel discussion that will follow. So first, we will hear from Vladimir Kakadze, who is the first deputy chairman of the Healthcare Committee of the Parliament of Georgia. So it's a wonderful way to kind of link 2 parliaments together. And I know that Georgia has had recently great steps forward on tobacco control. So we would like to hear more in next 8 minutes, 9 minutes of your successes and to inspire others. And it will be followed by also Matthew Myers, who is the president of the campaign for tobacco-free kids. But so we hear those 2 presentations, and then we go and jump to the panel discussion. Vladimir Kakadze, would be wonderful to hear from you.
დიდი მადლობა გამარჯობათ. მივესალმებით თამბაქოს კონტროლის ჩარჩო კონვენციასთან უკრაინის მიერთების 15 წლის იუბილის ორგანიზატორებს და მონაწილეებს.
My greetings, my warm welcome to the organizers and participants of the 15th anniversary of Ukraine's accession to the Framework Convention on Tobacco Control.
პირველ რიგში სანამდე ჩემს თემას გავაფსობდი, ამ საშუალებას გამოვიყენებ და დედამიწაზე COVID-ის მიერ მიღებული ტრავმის მოშუშებაზე ყველა სამძიმარს გამოუთქვამ დაღუპულების თაობაზე.
Before starting to the case story, I'd like to take this opportunity and to give my condolences to the live who have lost their lives due to COVID-19.
რამდენჯერ მინატრია ამ ბოლო წლის მანძილზე შესაძლებელი გამყარიყო თამბაქოს წინაშეც ვაქცინის გამოგონება, რომ ეს უბედურება ჩამოგვეცილებინა დედამიწისათვის.
I wish I could invent vaccine to tobacco to mitigate smoking related diseases.
ეს ხუმრობით რასაკვირველია.
This is just joke.
მე მინდა ცოტა მკაცრი ვიყო და მოუწოდო ყველას დისკუსიაში მონაწილეებს თუ ნებისმიერი ქვეყნის პარლამენტარებს და ყველა საზოგადოებრივად აქტიურ ადამიანს დაიწყოს ლაპარაკი თამბაქოსთან მიმართებაში. Tobacco clubs.
I want to be strict and I'd like to call for all citizens to start thinking and to start realizing that tobacco kills.
Tobacco's მოხმარებელი თავის საკუთარ თავს კლავს და კლავს გარემომცველ ადამიანებს.
Tobacco users kill themselves and kill others or surroundings as well.
აი ეს სიტყვები კარგად მინდა გაიგონოს თამბაქოს ინდუსტრიის ლობისტებმა.
And I wanted to raise my voice toward tobacco industry lobbyists.
საქართველოს თამბაქოს საწინააღმდეგო მოძრაობა დაიწყო 90-იანი წლების მეორე ნახევრიდან და პირველი კანონი მიღებულ იქნა 2003 წელს. 2006 წლის 15 მაისიდან ვართ ჩარჩო კონვენციის წევრები ცოტა მოგვიანებით უკრაინის შემდეგ. და შემდგომ 2008 წელს გავაუმჯობესეთ კანონი, რომელიც არ იყო სრულფასოვანი და შესაბამისად ნაკლებ ეფექტური გახდა. 2017 წელს კი დაძაბული ბრძოლებისა და ინტენსიური მუშაობის შემდეგ პარლამენტმა გამოიჩინა მტკიცე პოლიტიკური ნება და მიუხედავად თამბაქოს ინდუსტრიის ყველა მხრიდან ჩარევის მცდელობისა მიღებულ იქნა ყოვლის მომცველი რეგულაციები.
Georgia started the anti-tobacco movement in the second half of the 90s, and the first law was adopted in 2003. We have been a member of the Framework Convention since May 15, 2006, a bit later than Ukraine. Then in 2008, we improved the law, but it wasn't comprehensive and therefore less effective. And in 2017, after intense fighting and hard work, Parliament expressed its strong political will, and despite attempts to intervene from all sides of the tobacco industry, comprehensive or all-embracing regulations were adopted.
მხოლოდ ყომლის მომცველი თამბაქოს კონტროლის რეგულაციები არის ეფექტური და გადაარჩენს უამრავ სიცოცხლეს, რომლის მაგალითები გვაქვს უკვე საქართველოში. კანონის ამოქმედებიდან, ანუ 2018 წლიდან ხას უსვამ, ჩვენ დიდი ისტორია ჯერ არ აქვს ამის თაობაზე, მაგრამ 2018 წლის 1 მაისიდან 2021 წლის მიმდინარე პერიოდამდე საგრძნობლად 8-12% იკლო მიოკარდიუმის ინფარქტის მწვავე შემთხვევებმა, ფილტვის ქრონიკულმა ობსტრუქციულმა დაავადებებმა და ასთმის შეტევების შემთხვევებმა განსაკუთრებით ბავშვებში, რომლის ერთ-ერთი ხას უსვამ, ერთ-ერთი მიზეზი სწორედ პასიური მწველების დრამატული შემცირება და შენობებში ჰაერის ხარისხის ტოტალური გაუმჯობესება გახდა. წლინახევრის პერიოდში არანაირი უარყოფითი გავლენა მოწევის აკრძალვას, საზოგადოებრივ თავშეყრის ადგილებში რეკლამის და პოპულარიზაციის აკრძალვას არ მოჰყოლია ბიზნეს სექტორში, ამას ხაზი მინდა გაუსვა. პირიქით, გაიზარდა რესტორნების, კაფე-ბარების, სასტუმროების, სავაჭრო ობიექტების და სარეკლამო კომპანიების რიცხვი, ბრუნვა და დასაქმებულთა რაოდენობა.
Only comprehensive tobacco control regulations are effective and will save many lives, examples of which we have already in Georgia. Acute cases of myocardial infarction, chronic obstructive pulmonary disease, and cases of asthma attacks, especially in children, have decreased by 8 or 12% between May 1st, 2018 and 2021. One of the reasons for this is the dramatic reduction of passive smoking and the total improvement of air quality in buildings. For a period of a year and a half, the ban on smoking in public places, the ban on advertising and promotion in the business sector have not had any negative impact. On the contrary, the number of restaurants, cafes, bars, hotels, shops, and advertising companies, turnovers, and the number of employees have increased.
რაც შეეხება მწველთა რაოდენობას, 2018-20 წლებში თელს პოპულაციაში ეს სამბეჭდავია ჩვენთვის, ჩვენარი ქვეყნისათვის 3% შემცირდა რაოდენობა, იყო 31% და 2020 წლის მონაცემებით ის შემცირდა 28%-მდე. ჯერ მცირეა, მაგრამ ტენდენცია წლებისკენ აღინიშნება. ხოლო თავად მწველებს შორის 7% შემცირდა, მომხმარების მოცულობა კი შემცირდა 15%. ერთ-ერთი ინდიკატორი იმისა, რომ საქართველოში ეს ბიზნესი ნაკლებად მიმზიდველია, მეტყველებს ის ფაქტი, რომ ბრიტანულ-ამერიკულმა თამბაქოს კომპანიამ ხას უსვამ, ბრიტანულ-ამერიკულმა თამბაქოს კომპანიამ გასულ წელს დახურა მისი წარმომადგენლობა საქართველოში. იმედია, სხვა კომპანიებიც მალე გააკეთებენ იგივე ქმედებას.
As for the number of smokers, in 2018-2020, the whole population decreased or shrunk by 3%. It was 31%, and in 2020, it is 28%, while among the smokers themselves by 7%. The volume of consumption reduced by 15%. One of the indicators that this business is less attractive in Georgia is the fact that the British American Tobacco Company, or BAT, closed its representative office in Georgia last year. Hopefully, other companies will do the same soon.
ჩვენ ვართ ამაყი, რომ ასეთი ეფექტური კანონმდებლობა გვაქვს საქართველოში, დიახ, რომელზეც მუშაობის დროს არავის წარმოედგინა, ჩვენ ცოტა სხვანაირი ხალხი ვართ, ახლა დიდად არ გავსხვავდებით ჩვენისაგან, მაგრამ მაინც ცოტა სხვანაირი, რომ მივახცევდით ასეთ შედეგებს, როგორიცაა მოწევის აკრძალვა ყველა ტიპის საზოგადოებრივი თავშეყრისა და სამუშაო ადგილებზე, განსაკუთრებით სამასპინძლეო სექტორში, სადაც კანონის აღსრულება, ჩვენ წარმოიდგინეთ საქართველოს პირობებში კანონის აღსრულება ყველაზე მაღალია და 98%-ში ადგილს. სიგარეტის გამოფენის გარე და შიდა ხელვადობის აკრძალვა, რომელიც აღსრულებაც ასევე ძალიან მაღალი პროცენტია. სადა შეფუთვის რეგულაცია ძალაში შევა 2022 წლის 31 დეკემბრიდან შესაბამისი დოკუმენტაცია სამთავრობო აქტები მომზადებულია და მალე მიეწოდება სამთავრობო სტრუქტურებს დასამტკიცებლად. რაც შეეხება ელექტრონულ სიგარეტს, ელექტრონული სიგარეტი, გახურებადი თამბაქოს პროდუქტები და ახალი პროდუქტები მოექცა თამბაქოს კონტროლის კანონის რეგულირების ჩარჩოებს. ეს არის ის ნაწილი, რომელიც ჩვენ გვაძლევს საშუალებას თქვენს წინაშე მოგზალებული, მაგრამ ამაყი განცხადება გავაკეთოთ. თამბაქოს ინდუსტრია ხაზს უსვამ. თამბაქოს ინდუსტრია პერმანენტულად ცდილობს შეასუსტოს კანონი. განსაკუთრებით დაშვებული იყოს ისეთი პროდუქტების პოპულარიზაცია და მარკეტინგი, რაც პარლამენტმა არ დაუშვა და რამდენჯერმე არგუმენტირებული უარით გასტუმრებულ იქნა ბიზნეს ასოციაციები, რომლებიც გამოდიოდნენ როგორც თამბაქოს ინდუსტრიის პირდაპირ შეულამაზებელი ლობისტები.
We are proud to have such effective legislation in Georgia, and while working on it, no one imagined that we would achieve such results as, first, ban on smoking in all types of public places and workplaces, especially in the hospitality sector, where law enforcement is highest and reaches 98%. Prohibition of external and internal visibility of cigarette exhibits, the enforcement of which is also high. Plain packaging regulation will enter into force on December 31, 2022. The relevant government act is being prepared soon and will be submitted to the government for approval. E-cigarettes, heated tobacco products or HTPs and new products are regulated by the law on tobacco control. The tobacco industry is constantly trying to weaken the law, especially to allow the promotion and the marketing or advertising such products which Parliament has not allowed and has repeatedly refused to business associations that come out as lobbyists for proposals made by the tobacco industry.
მიუხედავად აღნიშნული წარმატებებისა, მცირეოდენი ხარვეზები კვლავ არსებობს თამბაქოს კონტროლის კანონში, რომელზეც შესაბამის დაინტერესებულ მხარეებთან ერთად მუშაობთ და მალე მოვახდენთ ინიცირებას. მაგალითად, ჯერ კიდევ დაშვებულია ჩვენთან მოწევა ტაქსში. ჯერ კიდევ არასრულწლოვანით მანქანის გადაადგილებისას ნებადართულია. სათამაშო ბიზნესის ნაწილში, სპექტაკლის გათამაშებისას და გარკვეულწილად დასარეგულირებელია და მკაცრად დასარეგულირებელია არომატიზატორების საკითხი იმ დაგვარად, როგორც ეს ევროპაშია. და ჩვენ მივესალმებით აი ამ კონვენციას, რომელიც ჩვენ განვიხილავს როგორც ევროპის სრულფასოვან და ღირსეულ წევრებს. გასაზრდელია გადასახადი ელექტრულ სიგარეტების სითხეებზე, რომ დაუახლოვდეს სიგარეტის გადასახადს და მრავალი სხვა. დიდი მადლობა, რომ დამითმეთ ყურადღება. სასიამოვნო იყო თქვენი ინფორმაციის მოსმენა და სასიამოვნო იყო ამ ფორმატში თქვენთან ერთად მუშაობა.
Despite all these achievements, there are still some shortcomings in the law on tobacco control, which we are working on with the relevant stakeholders and will initiate it soon. For instance, smoking is still allowed in taxis, while driving a minor, in the gambling business, while playing a play in theaters and so forth. The issue of flavorings should be regulated in the same way as it is in Europe. The tax on electronic cigarette liquids should be increased to approach the cigarette tax and so forth and so forth. It was very briefly I would like to mention. Thank you very much for inviting me and for giving me these excellent opportunities, and thank you very much to previous speakers for their comprehensive presentations.
Thank you, and it was very, very good to hear from your experience in Georgia and many of the aspects that have been applied. And I like to, and I think one aspect you said at the end, which is very, very important, I think, is that while much has been done in Georgia, they did big steps. You mentioned also that the road is not finished. There are still things that we as a public health advocates and public health specialists need to do for our next generations, that our children can actually live longer, not shorter. And even your joke in the beginning, I think it's an important, we need to find something against tobacco and to also then tackle other public health matters. And thank you for reminding us that we are still in the midst of the COVID outbreak, and there are many families who are suffering now, and there are many who are still in the hospitals, as they are also here in Ukraine. So thank you for reminding us also that while we do about tobacco control, there are other matters of public health, and actually we care about our future generations. So with this one, over to Matthew Myers to inspire us also, because you are a real advocate and you have working not only in Ukraine, many countries. So please give us a bit of more of the inspiration, what works and how to take it further for the next generations.
Thank you. It is a privilege to be here. We have been working in the Ukraine for almost since the very beginning when Ukraine ratified the Framework Convention. And there is no country that we have worked in that has made greater progress overcoming more challenges than in the Ukraine. The Campaign for Tobacco-Free Kids is a US-based or global organization that partners with and supports governments and civil society organizations like those we've heard from today to help countries meet their obligations to the Framework Convention on Tobacco Control for one reason and one reason only: it saves lives. This important work in the Ukraine, and we have seen it throughout the globe, has resulted in the adoption of policies all over the world that are decreasing smoking prevalence, are saving lives, and are beginning to make a fundamental change. These policies are proven based on sound scientific evidence, consistent with both international best standards and the WHO Fctc. It is no longer a hypothetical. We know they will save lives because the policies adopted since the Fctc across the globe are projected to have already saved over 35 million lives. However, and this is what I want to focus on to complement the extraordinary speakers today, when we ask ourselves the question, why haven't we made greater progress? There is one reason that stands above all the others. The tobacco industry was and remains a constant obstacle. It does not give up with a fight, even as it falsely claims, as it is doing in the Ukraine, and as it has multiple times before, that it is part of the solution. Indeed, the experience in Ukraine is all too typical. The tobacco industry works both openly and in secret to undermine and discredit those public health initiatives that will have the greatest impact for one reason and one reason only, in order to maintain and increase their profits. This bears repeating. The tobacco industry does not care about international law or the lives of the people of Ukraine. All we are to the tobacco industry is a source of profit. We've just heard a compelling case study from Georgia on policymaking in the face of industry opposition. I'd like to share additional cases from around the world that some of the ways in which the industry works, because it's important to understand that in order not to be fooled and in order not to allow it to happen in Georgia. Because none of the problems that you're facing here in the Ukraine are unique. And all of the opposition tactics, all of the opposition arguments that you're hearing against the new laws that's being proposed are arguments and tactics that we see all across the globe. They are from the traditional tobacco industry playbook. Let me just focus on three. Supporting industry allies, often behind the scenes and often through secret front groups, to undermine and delay tobacco control measures. Lobbying for deceptive, industry-friendly policies that are really designed to maintain the status quo and not bring about change. And feeding misinformation to decision makers on the economic and health impacts of proposed public policies. Let me give you some examples so you understand how widespread and how global these tactics are. In the Philippines, for example, the Philip Morris affiliate Fctc channeled its COVID-19 aid through several lawmakers in Congress, who then proposed industry-friendly rules to prevent effective regulation of novel tobacco industry products. A report in the Ukraine has detailed how these lawmakers sponsored an industry-friendly bill that would in fact undermine recent tobacco control efforts in the country and create favorable conditions for Philip Morris's affiliate, the only supplier of heated tobacco products in the Philippines, to expand its market and allow it to continue to reach kids. In Italy last year, a bipartisan group of politicians submitted an amendment that would have slashed the tax discount for heated tobacco products from 75 to 20%, thereby increasing the price on these products substantially. Eliminating that discount would have allowed the government to collect millions of euros and put a true impediment to the sale of these heated tobacco products to young people. As the largest manufacturer of heated tobacco products, PMI would have been hit the hardest. Then, at the industry's request, the proposal was rejected by politicians with close affiliations with the industry, including the Five Star Movement and the ruling Democratic Party, whose former leader publicly supports IQOS and even inaugurated Philip Morris's factory in the northern city of Bologna. In Mexico, at the end of 2020, tobacco control legislative champions introduced in the Chamber of Deputies a bill to amend the General Tobacco Control Law. And as you're trying to do in the Ukraine, bring it fully into compliance with the WHO Fctc. The tobacco industry attacked, and the bill is still stuck because of a barrage of initiatives and industry-friendly amendments that were designed to delay the bill's revision and delay the approval process. These initiatives included a tax on tobacco control champions in Parliament, amplified by pro-tobacco media, and a tax by pro-vaping associations on international organizations that have drafted the bill. In Romania, lawmakers from a tobacco-friendly Social Democratic Party killed legislation last year to ban tobacco marketing at points of sale with zero parliamentary discussion, despite the process going against all parliamentary norms. Fortunately, in Romania, they haven't given up. More recently, in January 2021, the tobacco industry got the ambassador of Japan to Bangladesh to lobby the government of Bangladesh on behalf of Japan Tobacco in order to defeat significant tobacco control legislation. We've seen tobacco companies use ambassadors from countries on multiple occasions to undermine tobacco control measures, including in your region and across the globe, and from places like Moldova, Venezuela, Hungary, Panama, Bangladesh, and Pakistan. The industry also has used front groups. Let me commend you to a multi-part investigation by the New York Times, which exposed how the US Chamber of Commerce helped the tobacco industry fight life-saving policies in more than a dozen countries, particularly in low and middle income countries vulnerable to bullying by the economic might of the US business lobby. Despite the fact, as we heard from my colleague from Georgia, and as we have heard repeatedly from other panelists today, that tobacco control measures actually help business, they don't hurt it. You know, we can always tell when the industry is behind certain arguments and policies, because quite frankly, they use the same language and the same tactics in every country. In that sense, it's important for the Ukraine to realize it isn't unique, and that the arguments that you're hearing today are the same arguments we hear everywhere from country to country to country. The fact that there is no evidence to support them, the fact that the industry peddles junk science, doesn't prevent them from continuing to try them on each new government whenever they think it will make a difference. A good example is the inaccurate concern that you've heard in the Ukraine and expressed by so many government officials in different countries that excise taxes will lead to illicit trade. It's a particularly common argument policymakers hear from the industry that is not backed up by the evidence. In fact, just the opposite. Country after country, as the Ukraine did, has raised its excise taxes, and the primary impact has been more revenue and more lives saved. So, for example, is the common argument against taxation that will hurt the economy, an issue of great concerns, particularly in these days of the epidemic. Ukraine's own successful history of taxes increases on tobacco products since 2010 counters that narrative, but it never prevents the industry from continuing to make it. And Ukraine's experience is exactly what happens in country after country. It is important to understand that they will never stop making the arguments despite the evidence. You'll also hear that preventing tobacco marketing and display at points of sale will harm retail businesses or the advertising industry. A claim that industry makes in every country, despite the evidence to the contrary, in every country where such laws have been adopted. I encourage all of you to look at the global experience so that the tobacco industry isn't allowed to get away with these false, deceptive arguments. The answer to these points is always to look to the number of countries that have passed strong tobacco control laws and have experienced none of the harms claimed by the tobacco industry, but just as in the Ukraine, have seen dramatic tobacco prevalence declines in tobacco use, improved public health, millions of lives saved. A few examples. As of 2021, at least 20 countries have enacted fully comprehensive tobacco control laws that cover virtually all of the key demand reduction provisions of the Fctc. As of 2021, over 50 countries have enacted comprehensive indoor smoke-free policies, and 46 countries have passed comprehensive tobacco advertising, promotion, and sponsorship bans. There are already at least 22 countries that have both a comprehensive taps ban and a point of sale display ban, which is what Ukraine is now considering. And these include countries like neighbors like Moldova and Georgia, as you heard, Armenia and Slovenia. At least 53 countries now regulate e-cigarettes under their tobacco products regime, and at least 38 of the 53 countries apply their smoke-free air laws to the use of e-cigarettes in public, just as we have heard recommendation after recommendation after recommendation. And at least 7 countries already subject heated tobacco cigarettes to the same tobacco burden and the same tax system as conventional cigarettes. It is critically important that we do so. These numbers will continue to grow. But the key, and this is the reason I wanted to make sure to have an opportunity to speak today, the key to passage is maintaining strong political will, not allowing the tobacco industry to run its playbook of tactics as a way to delay or weaken these laws, and a continuing dedication to public health. We have seen in the Ukraine that it works. We have seen in the Ukraine that when you do it, you save lives. We know what the task ahead of us is. We know the tobacco industry won't give up. You know, tobacco companies are simply unlike any other business. Their industry is built on lies, deceptions, manipulation, and hiding their truth. Their products kill when used as intended. Governments around the world must stand up to the tobacco industry if we are to succeed. Ukraine has been a shining example, and our hope is that Ukraine is prepared to take the next step, because when it does so, it will continue to both lead and save lives. Thank you.
Thank you, Matthew. And you brought so many different elements together. And I was thinking now, as we have heard 2 longer presentations, and the debate goes on, and we have been looking also what we know from policy, what is the politics, what is the economy, what are the impact to various sectors and levels of and the population groups. We have talked about the influence, and there are many things. So I think when we listen again today's meeting, I think we should listen a couple of more times to remind ourselves what is actually happening around us, because sometimes what Matthew you mentioned, we don't even realize that it goes invisible. And somehow we take it natural, but also I think a lot of people take it natural that today you can go to the restaurant and there is no smoke around. Today you go around and you don't see big advertisement. In Ukraine, I also walk the metro or bus station, and it is a different what it was 20 years ago, 10 years ago, and this was exactly the same. I remember when I was visiting Georgia a couple of years ago, and that was a very different environment when Georgia was 5-10 years ago. It was, you go to the restaurant and you smell actually the food and you enjoy the environment that is around you. So I think there are many things actually we like in the tobacco free, but it sometimes goes invisible, and sometimes we even forget what it was 10, 20 years ago, or as Ukraine is celebrating today, 15 years of Framework Convention of Tobacco Control. So with this one, also under the pressure of time, I would propose that we have in the panel 3 people first to reflect, and I would like to first to give a floor to Anton Skirak, because we have been talking about all those matters, but he as a doctor and sees the other side. What happens if you smoke for a long time? What is the impact? How it is currently as we go through the COVID outbreak? So tell us why we do all of this, because is there human suffering actually? And we then go after that to the public health element.
I sincerely thank dear international colleagues and partners for their great attention to the problems of smoking in our country. Of course, as an oncologist, I often see tragedies related to this, not politicians. But nevertheless, I thank the small part of the deputies who are on the side of the light and are fighting against the tobacco mafia in Ukraine. Of course, the best presentation is to show the fate of the person who smoked. Here's a computed tomography of patient who smoked for 1.5 years ago and changed ordinary cigarettes to electronic cigarettes. Let me show you, and I can show you the screen. One moment, please. She's a young lady. Do you see my screen? She's a young lady. She's 35 years old, and she changed the regular cigarettes to electronic cigarettes. Do you see that the both lungs are with cancer? Далі українською. Дорогі друзі, звичайно, як онколог хочу сказати.
And I will continue in Ukrainian. Well, dear friends, as an oncologist, I can say that issues such as smoking e-cigarettes and smoking regular cigarettes. Well, what I want to say, that smoking e-cigarettes is just a trick by the tobacco mafia. And it is unfortunately getting traction. And now younger people fall for this. Very often they come to appointments with different diseases. And 20 years ago, oncology as a field was rather for people 50 plus, people who had some prior diseases. But in the last 8 years, I see that the number of patients with oncological diseases, with pulmonary diseases, and with the diseases of the nasopharynx, they are young people, young Ukrainians, those who could work, who could pay taxes and develop our country. Unfortunately, tobacco companies, they offer a choice, a kind of a lighter choice, a simpler and more unique choice than a regular cigarette, something fancy that you have to refill that looks like an electronic gadget, and young people fall for this easily. So as a neurosurgeon and as an oncologist, I can say today the prevalence of e-cigarettes is higher than regular cigarettes. What I mean, there's less nicotine in e-cigarettes, but they consume more. And many people might see that when they smoke e-cigarettes, and you can see that they smoke more often. Also, if we only talk about the cancer of the trachea, of the bronchi and lungs, it's 15,000 Ukrainians every year. 15,000 Ukrainians who hear the diagnosis, cancer, and they hear from the doctor that, well, the situation is grave. Moreover, from these 15,000 Ukrainians, 60% actually do not live for even a year after diagnosis. So these people die within the first year after diagnosis. Today, countering the tobacco is a systemic challenge for the whole healthcare system. And we are not talking about the Ministry of Medicine. We're talking about Ministry of Healthcare. So it's about the whole healthcare system. And today we have many colleagues, many partners who are taking the effort to fight this. And I remember back then, decades ago, when Anton Skiriak, just a graduate back then, together with Professor Polishuk, going around all the factions in the parliament with that large tobacco pack and pictures of lung cancer, and we demanded to adopt the first law on the smoking ban in public places. This has helped us start a culture. And today, for example, we have to say that doctors cannot smoke. We cannot have smoking culture among healthcare professionals. If doctors save health, they cannot smoke themselves. So we also have to educate the new type of society, the society which understands that the highest value in the country is health, it's people. And it's not just the health of one specific individual or the health of that particular girl who is only 35 and who is now fighting cancer. She could live and be happy and pay taxes, but now she has to sell everything she has to pay for the treatment. And she cannot, for example, spend money for her children or spend money for entertainment. She will lose all her savings in order to survive because the tobacco industry has offered her a toy called an electronic cigarette. And I would like to say thanks to everybody who is fighting tobacco in Ukraine. We are not many, but hopefully we will soon manage to have new successes in tobacco control. And my dream is that tobacco would be a super elite product and one cigarette would cost $100 and smokers would have it only as an exclusive fantasy once a year. Thank you so much. Stay healthy. I hope Ukraine is healthy and free from tobacco.
Thank you, Anton, and thank you also putting it in the perspective as because obviously you are not only the doctor and oncologist, but you are a very strong public health advocate. And I think you touched a very important aspect. We need to have a different culture, and you brought very many examples and the human story why it is so important. I would like to go further to our public health center of Ukraine and Vladislav Banatsky, because the Ukraine Public Health Center has a role of guiding us, doing better NCD policies, monitoring, implementing many aspects. So how you see the current and the future, and especially in the light if many things happen and the regulation will be adopted?
Дуже дякую за можливість участі в цьому.
Thank you so much. Thank you so much for the possibility to take part in this roundtable. Indeed, the ratification of the Framework Convention has enabled us to introduce new, unique initiatives. However, for many years, this legislation has not been updated. And the current regulations are lacking enforcement. And now, actually, we see the increase in tobacco consumption. A negative aspect is that indeed the tobacco industry, using some loopholes in the legislation, is trying to successfully promote the novel tobacco products, the heated tobacco products and others. And the monitoring that we run shows us that indeed in the last year we saw the increase in the number of users of HTPs, over fourfold increase among men, and up to 10% from 3.4 among women. So currently, we are now implementing regional mechanisms to track the implementation of the framework convention. We have started with Vinnytsia and Kherson as pilot regions, and we already have good news. Our pre-project ideas have been approved by the Bloomberg Initiative, and we will promote these mechanisms further, scale them up in other regions of Ukraine. We have developed the strategy and the action plan. We have the roadmap on the acceleration of the implementation of the framework convention. We will look into the obligations which we have undertook and not implemented yet, and we would look into the approximation with the European directives. And also we are starting the preventive strategy. We see that it is difficult, that if a person encounters the situation when their rights for smokeless environment is violated, they can complain, but it's difficult to get the response, both from the National Police and the State Food Quality and Consumer Protection Service. So currently, from our side, we understand also that the awareness of target audiences is very important. It's very important to share the knowledge and understanding, share evidence, which shows that these novel products, just like traditional tobacco, are harmful and they do not bear the reduced risk and they are still harmful for the consumers. We have started working with the NGOs, with international partners. We started it last year and we are continuing it this year. We fully support the initiative of the members of parliament, the healthcare committee, with the efforts. This comprehensive draft law has been developed, and hopefully it would help resolve many issues which cause negative impact on the health of the Ukrainians. And hopefully the proposals of some MPs to reduce the excise for HTPs and e-cigarettes, saying that the budget would get more revenue, we hope that this would not be supported by the parliament. We have the healthcare priority. It is a higher priority than taxation and the interests of tobacco industry, indeed. So we welcome the efforts of the committee. Indeed, it has to be not a declaration, but it has to be implemented in a specific implementation of the law. And we are happy to support all the initiatives aimed at reduction of the negative impact of tobacco on the population. I would like to say thanks to Anton for his inspirational speech. Back in 2006, he was convincing the MPs to adopt the framework convention. So he is on the front line now, and he was on the front line back then. Thank you.
Thank you. And you brought in, I think, three very important aspects. One, we need to pilot new approaches if we want to get the change in public health. Second, the key is enforcement. And the third thing, you need to be determined over the decades, as you brought in the Anton's case as well. So I think it takes time to change the culture that many have changed. Maybe before we go to the closure, Matt, if you would have really three things that needs to get done in Ukraine this year, in spite of COVID, all other challenges Ukraine has ahead. So, but if you would have magic powers, what would be the three things in tobacco control we should keep an eye as of today?
Well, the first and the comprehensive one is pass the pending legislation without weakening it. The gaps in Fctc enforcement are weakening Ukraine's overall effort. Two, stick to it on tobacco taxes. They have done more to reduce tobacco use and save lives in Ukraine than anything else, and don't back off the strong provisions that you've recently enacted with regard to heated tobacco products. And three, make clear that Ukraine is absolutely committed not only to complying with all the EU standards on tobacco, but becoming the global leader that it has been. I often cite the Ukraine data to countries all across the globe as an example of what can be accomplished despite tobacco industry opposition to save lives. And I will say candidly, Ukraine's commitment to these issues on many occasions has been a deciding factor in other countries moving forward.
Thank you. I think it's impossible to summarize that. These three things really should be that all of us write down and keep an eye. And as we are today on the 24th of March, that if we go from month to month, can we keep the track? I think that's a very, very important part of the tobacco control. As the time goes on, and many of our followers have been sitting almost 2 hours, and as public health specialists, actually sitting for 2 hours without any movement, and it is not good either. So let's go to the closure. From my side, also on WHO, it has been a very informal and informative 2 hours to see various aspects and to do the justice of the rich discussion. I would not summarize that. I just want to thank that the Framework Convention colleagues have been joining us, WHO. We are also supported by all the UN, including the Resident Coordinator's Office, who daily asks how the things are going on the tobacco control in Ukraine. We have had the World Bank with us, European Union. We have been inspired by the other countries as well, heard from the doctors and the global evidence from the tobacco-free kids. So I think I really want to thank that such a rich discussion fitted to the 2 hours. And I like to thank also Parliament for the leadership. It's a leadership which we don't see in many countries, but in Ukraine we see it. We feel the leadership of the Parliament in the tobacco control. And that's really, really, really great to see. And before giving over to Lada to conclude, I wanted to thank also everybody who has been behind the scenes. There are people who are working on logistics. There are people who have been sending out the invitations. There are many colleagues who are working to have these 2 hours. And I like to thank also the interpreters, because as we're moving to this Zoom environment because of COVID, it has been actually enriched our exchange across cultures and cross languages, but it puts an extra burden to our interpreters. So I want to thank you also for all of that to make these type of meetings happen. So thanks to the partners, thanks to the determination, thanks to all who support, because there are many who would like to see the Framework Convention to be implemented in Ukraine, but many other countries. But over to you, Lada, because you have been one of the inspiring persons bringing us together and really spearheading the work on tobacco control. So over to you for conclusions. Thank you.
Yes, I add to all the thanks and the words of thanks that you mentioned. And I would like to make a promise. At least the Health Nation Committee will also keep the implementation on the radar, both in terms of WHO, Fctc, and also all the additional efforts. 15 years actually is an immense span. And the tobacco industry is making use of other forms of capturing the minds of the tobacco users. Therefore, I'm certain that our committee will rise to this challenge and address the challenges, and we will keep convincing all our counterparts and colleagues. Obviously, my colleagues on the committee are more open-minded, they are better accompanied, but we also need to educate and to raise awareness of the other parliamentary committees as well. We focus all our efforts to make sure this bill is passed in Parliament. We will not make any step backward and will not weaken our stance on excise taxes. This must not be done, and we will make sure to preserve the gains we made last year. Thank you, everyone. And until we meet again.
Thank you. See you again.